Ace, that's a cheer a volleyball player wants to hear. Not ace bandage to wrap their injured ankle. According to an article titled, A One-Season Prospective Cohort Study of Volleyball Injuries, 41% of all volleyball injuries are ankle-related. This type of injury can happen at any age, to volleyball players involved in recreational or competitive volleyball. While an ankle sprain is the most frequent injury among volleyball players, it can be treated and even prevented. Let's take a look at what an ankle sprain is. It's an injury to the lateral ligament of the ankle according to Strux and Kerox. The lateral ligament keeps the ankle from dislocating right or left during movement. Most ankle sprains in volleyball happen at the net when the player lands on the side of the foot after a jump. This will happen because the player was off balance in the takeoff of the jump, resulting in an inability to land correctly. However, the player can take off correctly and become tangled with a teammate or opposing player in the air, causing them to land ineffectively. This might seem complicated, but it can happen in a split second. It happened to me. I was at the net jumping to block a ball when the opposing player and I collided, causing myself to land on the side of my foot. It sounds like a minor injury, but from personal experience, I can vouch for the pain and embarrassment it causes. Even though the injury has already occurred, there is hope because it is treatable. Treatment for ankle sprains can vary depending on the severity of the sprain. According to Kirchhoff's, for acute ankle sprains, ice and compression are the best treatment to reduce the swelling. It may seem simple, but ice can reduce inflammation in the ankle, relieving some of the pain, while compression, such as an ACE wrap or a compression sleeve, will promote drainage of fluid built up in the ankle. For the more severe ankle sprain, immobilization or surgery may be necessary. When the ankle is injured severely enough, the player will not be able to function on the ankle, and a brace will be placed on it for several weeks. When a tear happens in the ankle, surgery is often necessary to repair the ligament, which may require weeks or months to heal. The good news is, ankle sprains are preventable. People often neglect ankle strengthening, which causes weakness. Exercises that isolate muscles around the ankle give support needed to land properly. Some sample exercises include ankle raises and isometric band strengthening exercises. Even if the ankles are strong, if the player lacks the proper technique when jumping, an injury can occur. Practicing the proper technique of the approach in volleyball can help the movements become second nature to the volleyball player, so that in games, the player can use proper muscle memory to avoid injury. Another method of prevention is the ankle brace. Although this should not be the only method of prevention, it can help the ankle to neither deviate left or right during movement. It must be used with caution as a temporary remedy only, because long-term use can result in the muscles of the ankle weakening. Looking back, people think that volleyball is a safe sport, but they need to be aware of the common injuries like the ankle sprain. Because the ankle sprain is the most widespread volleyball injury, it is crucial to understand the treatment, but coaches and volleyball players should focus on prevention. So the next time you are playing volleyball, remember, it's more than earning a point. It's about doing it safely. This allows the player to hear more ace cheers rather than hearing a trainer coming to place an ace bandage on their injured ankle.